Hi everyone. This week I found an article about workplace stress, and it talks about how stress may cause mental health conditions in the workplace. I know this is a little different than what we've been learning about this week, where people with mental health conditions may face discrimination and stigma, but it's actually occurring already in the workplace for people that may not already have mental health conditions. So I thought this might be an interesting article to discuss. So I'll start with the definition of what workplace stress is. It's defined by the World Health Organization as the response people may have when presented with work demands and pressures that are not matched to their knowledge and abilities in which challenge their ability to cope. It can be caused by poor work organization, poor management, unsatisfactory working conditions, lack of support from peers and employers, and sexual harassment and bullying. Although there are laws in place that are supposed to protect rights of employees, the application is variable and suboptimal. So the author talks about an evidence-based interventions, and he mentions a cross-sectional study that was conducted across 35 countries, and it was found that 2/3 of the employees reported depression or discrimination at work. The anticipated and perceived discrimination was higher in high-income countries versus low-income countries. So basically, what they found was if the organizations are aware and cognizant and take care to heed to the employees' mental health and well-being, appropriate mental health care could be implemented either in the workplace itself or outside of the workplace. Organizations should focus on creating an environment where employees feel comfortable discussing mental health needs as well as encouraging a work-life balance. Because what they were finding in this study was that people were reporting discrimination or afraid of being discriminated against if they were reporting how stressed they were or the mental health conditions that they were developing as a result of this stress. So one of the interventions they found was that if the environment was welcoming of accepting someone with a mental health condition, that it would decrease the stigma, the discrimination, and the stress levels of the employees. So the author also mentions other interventions that can decrease stress, which include cognitive behavior therapy for stress management, adequate employee control, physical activity promotion. And I just wanted to mention that I worked with someone whose husband worked for a corporation, and of course they made a lot of money, but they also had a gym at the facility where he worked. And it made it very motivating for him to engage in physical activity, and he found it to be a great stress reliever. During the workday, they would purposely make time for their employees to have that opportunity to engage in physical activity. And I thought that was a great way to kind of advocate for mental health and well-being. And they also, another intervention that was mentioned by the author was problem-focused return to work programs for people that may had to take a leave of absence because of their mental health. So here are just some outcomes of stress in the workplace. Discrimination, poor work quality, decreased quality of life, decreased wellness, physical disorders, including hypertension and diabetes, and increased absenteeism. So the World Health Organization has come up with key factors that are related to stress at workplace and have advocated for guidelines to redeem those key factors. The key factors that were identified that increase stress at the workplace include workload, lack of participation and control in the workplace, monotonous or unpleasant tasks, role ambiguity or conflict, lack of recognition, inequity, poor interpersonal relationships, poor working conditions, poor leadership and communication, and conflicts at home and work demands. So they identified 4 key guidelines to address workplace stress in general, to decrease the stress as well as the mental health conditions that may occur as a result of that stress. So the first step that they outline is to have a clear understanding of incidence, prevalence, risk factors, and cost implications associated with workplace stress. It can be conducted through data collection, such as surveys, and this should take place across the organization. The step 2 that they mention is to develop the policy. Once the data is collected, a policy can be developed to address all concerns of stakeholders and organizations that support the mission and vision. It could be done through multiple meetings where the different stakeholders identify key components that need to be addressed, and this is a continuous process. So once you go through developing the policy through these meetings, it leads into step 3 to develop strategies to implement the policy. And processes needed to implement strategies, goals to be achieved, and timelines are established in step 3. And then step 4 is the final step, where implementing the policy and formal evaluation to ensure the policy is effective. And what they're finding is that, well, for one thing, is organizations do not go through these steps in order to ensure the mental health and well-being of their employees. And they may go through the steps, but they don't go through everything that's involved in the steps to make it effective. So the role of the government also plays a huge role in decreasing employee stress and increasing well-being. The role of the government should be to ensure policies are being implemented, identify vulnerable populations, and monitor and ensure additional strategies are in place at organizations to ensure an employee's well-being. I just thought this was an interesting article because I find this happens a lot in the workplace, and I think it is really based on who your employer is and if they care enough to implement some sort of plan or policy that's mentioned in this article to ensure that their employees are not getting burnt out and to ensure that there is a sense of well-being. Because I find that in healthcare especially, we have very stressful jobs. And I think this definitely impacts our ability to be able to provide the best care for our patients. I mean, it's not an easy thing to do when you're stressed out and you have to see 15 people in a day. And sometimes you might not make the best decisions. And at the end of the day, it is about our clients. So I think it's important, especially when we graduate and we're out there after we take the boards and we pass the boards, to find a job where the employer actually cares about your well-being. I think that's an important thing versus just taking the first job that might become available. Because at the end of the day, it's about our well-being and our families, and I think it's just an important thing to consider, and I hope you enjoyed this lecture.